Good afternoon. It's very nice to be here for, I think, this inaugural event. So I'm going to talk to you about a different topic, which is suicide in Nevada. And I'm going to take us through some descriptive information first so that I want us to understand how Nevada suicide rates compare to national rates, how there might be some disparities within suicide rates within Nevada and maybe what to do about them, the impact upon community and our healthcare system in Nevada, and also to briefly look at suicide prevention efforts in Nevada, and as well as to identify some opportunities to improve outcomes. So first, we need to understand the language. And when I first started to look at suicide, this was all new language for me. So a contemplator is someone who thinks about self-harm, intends to end his own life, his or her own life, but has only really thought about it. Sometimes we'll have a plan, sometimes not have a plan. An attempter is someone who acts on those thoughts and injures him or herself. A contemplator is somebody who, a completer is someone who ends his or her own life. And when we look at suicide rates, it's typically the completers. The survivor, interestingly, is defined as someone with a close personal relationship to someone who's completed or committed suicide. Now, just some brief facts. Nevada has the 5th highest rate in the U.S. We had been the leader in the country just a few years ago, and we vacillate in the top few in the U.S. In Nevada, suicide is the 6th leading cause of death. And in the 10 to 24-year-old group, it's the 3rd leading cause of death. I'm going to take us first through kind of a worldview just for perspective. So the areas that are kind of orange and kind of peach colored, they're very high rates. The areas that are kind of the yellowish, which includes the U.S., is sort of a moderate rate, so 12 to 16 per 100,000. This is data from the World Health Organization, and those in blue and green have lower rates than we do. So kind of nationally, we can look at ourselves in terms of the world. Looking next at the U.S., the dark blue is the highest rates of suicide. And you notice Nevada and a lot of surrounding states, with the exception of California, are in the highest rate. And so we are considered the western, or in many cases, the Intermountain Western states, and we all have high rates of suicide. Want to look a little bit more closely at national rates. Right now, the number 1 leader in this area is Alaska. Nevada, you can see, which is in green, is very close behind. This is the U.S. average, which is quite a bit lower than where we are. The District of Columbia has the lowest suicide rate. We've used a statistical package called MedCalc to actually compare the rates, and we can see that the difference between Nevada and the District of Columbia is statistically significant. This is all based upon CDC data, and it is anticipated that Nevada will become statistically significantly different than the U.S. average. Going on and looking at injury and different modes of injury, we can see that suicide deaths, you can see this upward tick over the years. The latest data that's available is 2010. It surpasses motor vehicle deaths in our state. When we look at other injuries, including homicide and falls, while they're very significant, are much lower than suicide rates in our state, and they have been for quite a long time. Also want to start to look at disparities by demographics. So first, looking by age, we can see that the top purple line is our geriatric population, and that's 55 years and older. Next, 35 to 54, and all the way down to 10 to 19 years. So we can see the rates are very high, and these are all population adjusted. So they're very, very high in our older population. And this is very significant, and they're statistically significant as well. When we look by gender, and again, these are suicide rates, these are people who've died as a result of intentional injury against themselves. Among males, it's statistically different than females. This is both national and Nevada data. What is, I think, important to remember I haven't covered that in this talk, but when we look at all people who are thinking about suicide or who attempt, the females really start to catch up with the males. They're just not as likely to die as a result of those thoughts and actions. I want to look also by race and ethnicity, and we can see the bar on the left, which is very, very high, are white males, and this is both national as well as in Nevada. So statistically higher in Nevada than Hispanics, Blacks, and Asian Pacific Islanders. There is not a statistical difference, although it looks so, like there would be, between American Indian, or AK means Alaska Natives, and there's not yet a statistical difference, but again, it's projected that there will be. We've used a common statistical significance of p less than or equal to 0.05 in this look. So we can see that whites are, white non-Hispanic are at tremendously high risk, as well as the elderly so far. Want to look at our seniors, and this is a slightly different analysis, slightly different age bracket than in the previous slide, but again, this is commonly used in research. So here's Nevada at our high rate of elder suicide compared to the US average, okay? So see, it's actually over double. Now, if we compare this with other Western states, they're also high, but we lead the nation in suicide rates among elders. We're number one. That's not where we should be, right? And so this will be interesting discussion, I think, both in the question and answer period as well as in the sessions later on. Don't want to forget about youth. I mean, look at these numbers. These are for Nevada. Over 60,000 of our youth thought about suicide. 50,000 of them had a plan, okay? 35,000 are, actually attempted it one or more times, and we lost over 600 youth in suicide. And this is 2009 data, and again, it lags by several years, but it's very reliably collected by the Center for Disease Control. So I just want to briefly look at impact. If we look around the US, over 100 people a day commit suicide. Over 1,300 come to the EDs every day, and this is national data. This should be labeled as Nevada data. When we look at years of potential life lost, almost 10% of those years of life lost in Nevada are due to suicide. This is alarmingly high. Native American youth also have high rates of suicide. Firearms, which is a very controversial topic in the U.S., accounts for it's used in 59% of the deaths. Just want to give you an idea of my life. This is data. This is analysis that we did on the National Trauma Data Bank. And we looked at cause of death of all of our patients that we admit to trauma centers. This is national data. So deaths due to suicide account for 67% of the deaths that I and other trauma surgeons see in our work. So we can see that pales compared to homicide and unintentional injury. Homicide is what gets all the news press, right? Not suicide. If we also, in the past, we've had a grant from the CDC looking at Nevada suicide rates. One of the things we wondered, we get so many visitors here, millions and millions. So are they visitors who come and they lose their money or their house and they jump out the window off the balcony? And the answer is not very often. Mostly it's our own citizens. So it's nearly 90% of our own citizens. And we spent a lot of time trying to tease up that data. Briefly going to just list the suicide prevention organizations, and I'm sure this is just some of them. There's a lot of great effort, a lot of good energy. There's probably not enough work in this area, and I think it's thought that there are very inadequate sources for all issues in mental health in the state of Nevada. But I really want to commend the people who try, and some of them are in this room. So what should we do about it? Again, the CDC, they really do wonderful work in their areas of concentration. For many, many years have really stressed suicide and suicide prevention. So what should we do? We need to teach the community. In adults, actually, an alarmingly high number of people have recently seen a physician, and the physician just didn't catch the fact that they might be suicidal. In youth, they don't see doctors as often and healthcare professionals, so it's really important to educate the community, to identify supportive services, and to make those connections. The U.S. Air Force, as have all military organizations, put a lot of effort in suicide prevention, which has certainly gained a lot of publicity. They've had really significant efforts in this area, and again, they try to remove the stigma. They connect them with supportive services, and this is an Air Force study that decreased the suicide rate by 30%. Most of them really don't look at how many people are thinking about it and so forth, so a lot more work needs to be done. So kind of in conclusion, we are right now at the 5th highest rate in the U.S. Males are distinctly higher in terms of their completion rate than females. White, non-Hispanic are at risk. There appears to be some protective race and ethnicity factors, probably cultural, for some of the other groups. Native Americans are also at very high risk. Older Nevadans, we really need to improve the suicide rates among older Nevadans. We don't want to lead, as a matter of fact, we'd rather be 51 out of 51, right, rather than 1 out of 51. Youth suicide is very significant, and we can't really ignore this, because when we look at years of potential life lost, I mean, that's really greatest in that population. Tremendous impact on our communities, on all of us. Most of us know someone who's committed suicide. It also has a huge impact upon healthcare. It's very costly, but more than anything, we lose productive lives in our state and throughout the country. More injury prevention is needed. I hope I covered the objectives that I set out to. Be happy to answer any questions later. And I would really like to thank the Nevada INBRE and all of the people who helped to plan this Disparities Conference. And thank you again for your attention.